Gabapentin Enacarbil, which goes by the trade name Horizant, is an FDA-approved drug for the treatment of restless leg syndrome and a consensus first-line treatment among restless leg syndrome experts. But just how does it work? And is it work better or differently than other drugs in the same class? I'm Dr. Andy Berkowski of Relax Health, and today we're going to talk about Horizant. Well, Horizant is among a group of drugs called alpha 2 delta ligand calcium channel blockers. For most of you, that really is a bunch of gobbledygook, but it really is a nerve or brain medication that decreases the signaling of brain cells that are talking to each other. In the case of nerves, it would be to produce less nerve pain. In the case of restless leg syndrome, it would be to quiet down those sensations of creepy crawlies in the legs or the urge to move legs. This is a consensus first-line treatment. In fact, for whatever it's worth, it's the only FDA-approved medication for restless leg syndrome that's still recommended, as all of the other FDA-approved drugs are dopamine agonists, which we no longer recommend in the treatment of restless leg syndrome. Now, there are two other drugs in this class. One is regular gabapentin and one is pregabalin or Lyrica. Well, I've talked about elsewhere how Horizant is both the same and different than regular gabapentin, but let's talk more about Horizant and how this medication works. One of the ways in which it's beneficial, even compared to regular gabapentin, is it has really good absorption. So even though it's considered extended release or a long-acting drug, it really isn't because the capsule itself is long-acting. It's how it gets into the body. Gabapentin Enacarbil or Horizant, it is swallowed, it goes into the stomach, and then it starts to go through the intestines, but it uses these high-capacity nutrient transporters that help to pull the drug from the inside of the intestines into the bloodstream where it can actually get into the brain and help with symptoms. This happens over a long period of time because throughout the intestines, as it's going down the tube, it gets absorbed and more absorbed and more absorbed. In fact, it's absorbed anywhere between 40 and 65% on an empty stomach and up to 75% with food, according to the studies of this drug. That means you could also take higher and higher doses of it and still get 75% absorption. As a comparison, regular gabapentin really is limited at about 400 to 600 milligrams with food. It's not really absorbed at all above those levels. So you can't really take, say, 1200 or 1800 milligrams and you really don't get anything else in you. But even at 1200 milligrams, it's absorbed at 75%. Some restless leg specialists use it at 1800 milligrams. It's generally taken with dinner because it's absorbed better with food, but also because the drug gets absorbed over time. So if restless leg symptoms are happening more at bedtime and during the night, that's when this drug is starting to have its greatest effect. It really peaks at about 7 hours, but that upslope of the peak, 4 to 5 hours, you eat dinner at say 6 o'clock, go to bed at 11, 5 hours of absorption, now that drug is really working. In fact, it can have a positive effect on symptoms from 12 to 24 hours in some cases. So it's not really long acting, it's more long absorbing and therefore provides relief for a longer period of time. This also is part of the downside of the drug is that for some individuals, if they experience dizziness or drowsiness, which are two of the more common side effects, they can have those not wear off by the next morning. So that is where the balance of this medication lies between the positive effect and any of the side effects, as with all medications. But Horizant seems to be more than just fancy marketing. Unfortunately, it is an expensive drug currently, and most insurers will not pay for this medication. However, there are independent pharmacies now offering it at a reasonable cash price, still expensive, but within reach of many individuals. So look around for potential discounts or places to get this medication that is more affordable. And hopefully, as the clinical guidelines continue to support these types of medications as first-line medications for restless leg syndrome, either the insurance coverage or the cost or both will improve, and it'll become more accessible to a wider group of desperate restless legs patients, given the limitation on the number of treatments that are available for this condition. As always, this video is for general informational purposes only. It does not constitute medical practice. All of these medications, suggestions, recommendations, any changes to you should be made under the guidance of a licensed clinician. And as always, one of the keys to sleeping well is to relax.